my typical idea of treating somebody or is to try first the natural things. Okay, so instead of going directly to the medication, we have to look at the reasons why a person is not getting sleep. So there are two aspects of sleep. One is the quantity of sleep and the other one is the quality of sleep. So quantity of sleep means we should be sleeping for about 6 to 8 hours. The adult requires a sleep of about 6 to 8 hours. At least there should be 4 sleep cycle. One sleep cycle is for 1.5 hours, because there is NREM and REM stages of the sleep, and that takes 1.5 hours. So 4 sleep cycle means about 6 hours. So usually 6 hours are needed for completing the 4 sleep cycle. 5 sleep cycles would be much slightly better also, but so therefore 6 to 8 hours is a good sleep time. Now those people who are not getting, so this is about the quantity of sleep. Now to maintain that quantity sleeping, there is a sleep hygiene or sleep discipline which we need to maintain. So those people who are not getting sleep, they should not have caffeinated drinks after 2 p.m. because if they are very sensitive, so at 2 p.m. 3 p.m. after that they should not have tea or coffee, because that will reduce the sleep. They should stop seeing the screen, because screen is considered as the white light or sunlight, and it is perceived as the sunlight by the body. And melatonin secretion is very important for induction of the sleep. So people, if they are watching their mobile till the time they want to sleep, or they are watching TV or any gadgets or laptop, the chances of melatonin secretion, adequate medical melatonin secretion will go down, and therefore the induction of sleep and maintenance of sleep will go down. So therefore they have to improve the sleep hygiene. And that the kind of lights which we have in the room and all, warm yellow lights, so those are considered as night lights, while white lights, the tube lights which we get, are considered as, so all these screen lights as well as those kind of lights should not be there once 2 hours before the sleep, so that our melatonin starts secretion. And practicing, again, as I told you, there are various ways. A lot of meditations are available. I myself practice Yog Nidra, which helps to induce a good sleep. And this people can follow their own way, so that their stress is reduced. If there is a lot of thinking going on in the mind, the chances of you getting a proper sleep is also down. So reading very light literature, not reading too much at one time, or becoming very active in the night in terms of work thinking process, will reduce the chances of having a sleep. So this is about some sleep hygiene which has to be there. Similarly, do not drink too much of water before sleep, because otherwise you might have to get up to pass urination, and then that might also disturb the sleep. And then comes the quality of sleep. So somebody might be sleeping for 6 to 8 hours, but they are a heavy snorers, as I was discussing with you. So if they are heavy snorers, their snoring occurs because your muscles are collapsing and causing an obstruction to the airflow. So if the airflow is not happening properly, the oxygenation will not reach, although it appears that the person who is sleeping with snoring is in a deep sleep, but that's not correct. He's not getting adequate oxygenation during the sleep, which is very important for the recovery and of all the damages which we have done throughout the day. So sleep is the repair time, and oxygen is very important molecule for the repair process to be initiated. So if you're the person is not feeling fresh after getting up in the morning, lack of energy is there all throughout the day, they tend to feel little lazy, they tend to doze off if there is nothing else to do. These could be signs of obstructive sleep apnea syndrome, and therefore they should go to a sleep specialist to get it rectified. So these would be my suggestions for sleep thing, and the last resort is to take medications.